COVID-19, novel coronavirus, comes to the U.S. and sickens millions worldwide.
We have to take this seriously. This is a virus we've never seen before.
Particularly devastating and deadly for the elderly, people with pre-existing conditions, and communities of color.
It's about addressing those underlying issues like the chronic conditions.
Racism is real.
At every level, city, county, and state, racism has been declared a public health crisis.
This is something that should concern every single Ohioan.
We are in a crisis that definitely has to stop.
Tonight, we're shining the light on what that means for you, for your neighborhoods, and for our future. And of course, the word racism, it really is a tough word to come to terms with. There is certainly a negative connotation, but that is why, in fact, we want to have this important conversation with you this evening. So we do thank you for joining us at 5:30. I'm Tracy Townsend.
Hello, everyone. I'm Scott Light. Talking is key here, and as Tracy just said, that's what we want to do. That's our hope tonight. We need to talk about this. We need to bring up this difficult conversation at times so we can all learn to be better. So let's highlight what we're going to be talking about here in our next half hour. We're going to talk to health professionals about this crisis. We're going to take a closer look at the terms associated with racism. And we will certainly have to explore talking with your kids about this topic. Let's, however, begin with Kevin Landers on what the crisis itself actually means.
The protests over the death of George Floyd went beyond the issue of police brutality. They also spoke to the disparities between Black America and white America, namely the lack of equity in healthcare, education, and more.
There's a big gap, whether it's in education, housing, the medical areas. We need to provide the funding that's needed to help.
At a hearing last week at the State House, Democrat lawmaker Sandra Williams introduced a resolution asking lawmakers to declare racism a public health crisis.
And we've been facing this for years. Our families have been facing this, and it's become normalized to a lot of families. But I think right now is a great opportunity for us to stand up and say not anymore.
The resolution would declare, among other things, training of all elected officials and staff on workplace biases and how to mitigate them, incorporating educational efforts to address and dismantle racism and expand understanding of racism and how it affects individuals and health, encouraging community partners and stakeholders in the education, employment, housing, and criminal justice and safety arenas to recognize racism as a public health crisis.
In Ohio, unfortunately, Black and brown Ohioans have less access. They're less likely to have health insurance.
Senator Williams says in order to tackle racism head on, it begins with educating her fellow lawmakers.
There are some of my colleagues that do not believe that there is systemic racism in Ohio.
Reporting from the State House, Kevin Landers, 10 TV News.
So let's stay at the State House, because something happened there last week, and people say that that was an example of implicit bias. Now, you're going to hear some audio here, and it's tough to hear, so we're going to have some captions on the screen. Let's play that video and audio from Ohio State Senator Steve Huffman.
I understand African Americans have a higher incidence of chronic conditions, and that makes them more susceptible to death from COVID. But why does not make it more susceptible just to get COVID if we know it's twice as often correct? Could it just be that African Americans or the colored population do not wash their hands as well as other groups, or wear masks, or do not socially distance themselves? Could that just be the explanation of why the higher incidence?
He was later fired from his job as an ER doctor for those comments that were widely considered to be racist. Senator Huffman said he didn't intend to be derogatory. The Senate will now hold training on diversity, inclusion, and implicit bias. So what is implicit bias? Well, these are attitudes or stereotypes that affect our understanding, our actions, and decisions in an unconscious manner.
Training is a first step. One member of Ohio's Minority Health Strike Force says training is the first step toward each of us taking responsibility for our biases. Charlita Tavares is a former state lawmaker and now head of Primary One Health and an appointee to Governor Mike DeWine's Minority Health Strike Force. She told me in taking on racism as a public health crisis, each of us has to first identify and recognize our own bias and then pivot.
If you're an emergency room doctor and you have those kinds of feelings, I'd be scared to have somebody like that having my life in their hands.
Charlita Tavares made history as the first woman Democrat to serve in leadership in both the Ohio House of Representatives and Ohio Senate.
We all know that you were in leadership in the legislature. I mean, was that normal? How out of the ordinary was it for somebody to verbalize such a...
I'm glad you asked that question, Tracy. And I'm glad that we have now public hearings that are live streamed and archived, because this kind of language has been going on for many, many years.
Tavares is now the CEO of Primary One Health. It's a comprehensive federally qualified health system with 11 sites in 2 counties. She says the offensive language from Senator Stephen Huffman at that recent hearing on racism as a public health crisis peels back a critical layer.
If you were already using terms out of the 50s, 40s, 30s about coloreds and negative stereotypes around washing one's hands and whether people who are colored wash their hands frequently enough, that goes back to the stereotypes that many corporations, including those that sponsored soaps and powder detergents, had around African Americans not being clean.
She's a subcommittee chair on Ohio's Minority Health Strike Force, which was launched by Governor Mike DeWine back in April to address how the COVID-19 pandemic is disproportionately affecting blacks across the state. The task force's interim Stay in the Fight report sets up nearly 20 immediate action steps to handle issues with health care, education, data, and research. Tavares says it is also critical that lawmakers look at every policy through a health lens to see the impact on African Americans and people of color.
Almost every health condition known to man and woman, African Americans and people of color have inequitable outcomes, dying prematurely in many cases, dying unnecessarily.
Tavares says the demonstrations and protesters nationwide and here at home are proof that change is the only option. And now is the time because young people are now at the forefront.
They are continuing to protest because they see it. They've experienced it from the beginning of their lives.
And leaders within the city of Columbus say they are working to address the change and specifically health disparities. Mayor Andrew Ginther says minorities are more likely to work hourly jobs where if they don't work, they don't get paid. Ginther says those jobs often offer little to no benefits. Mayor Ginther says it's often people of color who work on the front lines, putting them at greater risk for getting sick with the novel coronavirus. Columbus Public Health Commissioner Dr. Mashika Roberts says this is really a learning moment.
It's about addressing those underlying issues like the chronic conditions and what we can do to prevent them or better treat them so the next time we have a virus like COVID-19, we won't see this same impact with our communities of color.
And Dr. Roberts says she hopes to give more recommendations by the end of this year, so we will be tracking that. And we're going to continue our special Shining the Light coverage of racism as a public health crisis, including how to talk with your children. Shortly after the Franklin County Commissioners declared racism a public health crisis, the state's fastest growing county, Delaware County, did the same. The demographics are certainly different. According to the 2010 U.S. Census, more than 80% of Delaware County is white, followed by Asian at just over 7%, and Black or African Americans making up about 3.8% of the population. The Delaware General Health Community Health Director, Jen Kagi, told me they're already working with community partners and working to make education a priority.
Really, the next step that we want to take is looking at policy and system changes. Because it's good enough to teach somebody, but if we're not trying to change the system, we're just going to keep putting little band-aids on the problems.
We want them to take it a step further and to do anti-racist training, implicit bias, understanding what microaggressions are, truly unpacking and deconstructing systemic change. And we really want to be a part of partnering with them to help them do that.
And before having an honest conversation, we have to know what we're dealing with, right, in terms of real words, real definitions. So let's explore that, what we really mean here when we talk about several things involving racism. Let's begin with a definition. Racism is prejudice, it's discrimination or antagonism directed against a person or people on the basis of their membership of a particular racial or ethnic group, typically one that is a minority or a marginalized group. Second, social determinants of health. You've probably heard this as well. These are conditions in the environments in which we're born, we live, learn, work, etc., that affect a wide range of issues like healthcare, life, schools, education, and a lot more. And then third, anti-racist. That's someone who opposes racism and promotes racial tolerance. Let's check our poll question for tonight. As we've been reporting to you, Columbus State plans to remove that statue from the middle of campus. So we ask you, do you think they should make that move? And boy, talk about a real turn here. We put this online, this poll, this megaphone question at 4 o'clock, and the yeses were in the majority when we came on the air about 5 o'clock. And now look, 78% of you who have been weighing in are now saying no, that the statue should not be removed. We're going to keep this poll question up online. Come visit us at 10tv.com/vote, and we'll check the results again during our 6 p.m. newscast.
And we continue to shine the light on racism as a public health crisis. Earlier this month in Central Ohio, healthcare providers checked in on the national discussion about this topic. They called it White Coats for Black Lives, and doctors at Ohio Health Riverside, Grant Medical Center, and Dublin Methodist were part of this really powerful movement here, this moment. Doctors at each hospital knelt in a moment of silent reflection as a show of strengthening their commitment to improve the health and safety of all people of color. Healthcare providers from the OSU Wexner Medical Center participated as well as this team from the Spielman Comprehensive Breast Center.
Every individual has to be accountable. There should be no racism. There can be no racism. There can be no brutality, and Black lives do matter.
OSU Wexner Medical Center CEO Dr. Hal Potts told me this afternoon the hospital system is working to tackle issues of systemic racism and their effect on health care for the 30,000 employees and patients who are treated there.
More now than frankly ever before, there's this enormous responsibility to act and to make a difference in the lives of so many that count on us.
And Dr. Potts marks 1 year as the top doc at Ohio State this week. Over the course of that time, he led the medical center through the once-in-a-century pandemic, the economic consequences of it, and now the impact of racism.
Well, as parents, we have to have tough conversations with our kids, and this is certainly a topic that has to be discussed in households out there, not just in Ohio, but across the country. And these conversations are happening largely because of the protesting that is happening out there as well. So we talked to some experts about this, and they say this, that the first things all parents should know are these. Talking about racism is an important conversation that has to happen. So our sister station in Austin spoke with 2 professors who are also parents. They say the conversation is different when talking to white children versus children of color.
It means having the difficult talk about the reality that when you leave the doors of this home, that you're going to be seen and viewed and treated differently because of the color of your skin. And that unfortunately there are, some people out there who have negative feelings about people of a different skin color. And, we just try to help our kids understand while that exists, that, they are just as good as anyone else, and help them to sort of not internalize those feelings.
Parents, you should also keep this in mind. According to the experts, the depth of the conversations that you're having with your kids depends on the age of your kids. And as we move forward, we will be sure to cover all the moves that our cities, our states, and our country, all those moves, all those entities are making in response to racism being a public health crisis. You can look for our continuing coverage online 24/7 for you at 10tv.com.